At the time of transplant listing, our team has decided whether the patient should be transplanted on the left, the right, or both sides, or sometimes we leave the door open to multiple possibilities. An incision can be what we call a thoracotomy scar under the left or the right armpit, or sometimes if it's a bilateral transplant, the incision is under the breastbone in what we call a clamshell incision, so that both lungs can be transplanted in the operating room through one incision. The surgery itself takes somewhere between 2.5 and 5 hours, and the patient leaves there to the intensive care unit.
They will be on a ventilator. They'll have different lines. They'll have an arterial line, they'll have a line in their neck, they'll have chest tubes, they'll have a Foley catheter, they'll have a nasogastric tube going into their stomach that'll drain the contents so that in the event that they would have a vomit, it won't go into their new transplanted organs. So we're monitoring everything that goes into the patient as well as everything that comes out. It's quite frightening for the family following transplantation because the patient comes out, has quite a bit of swelling in their face, their hands, and the patient is sleeping. They're under sedation until they're able to breathe on their own.
And gradually comes off of oxygen over the course of a couple of days, moves out of intensive care, begins sitting and walking within days.
They start working with physical therapy. We make sure their nutrition is good. The dietitian will come to see them. We do daily labs, sometimes even more frequently. And in that time after transplantation, we encourage the patients to be as active as possible, getting up in the chair as often as possible, because we're trying to get these new lungs to start working as effectively as possible. In addition, we have the patients breathe into a little machine so that they expand the lungs and open up the airways and get that lung functioning. We try to start working on discharge from the moment the patient is transplanted. Immediately upon transplantation, we start looking at discharge. We start trying to educate the family once the patient is off the ventilator and the patient. We go through the process of providing information on medications, diet, activity, bronchoscopies, follow-up visits, clinic visits.
The average lung transplant recipient is in the hospital for about 2 weeks after the transplant, although sometimes it can be much shorter than that, on the order of 4 to 5 days, or if some complications arise, unfortunately a patient could be in the hospital longer than those 2 weeks.